Sushant, congratulations on doing fantastic work, which is really helping audience and patients, not only for chronic diseases, but also for, highlighting, the science part of it, and, how one can have a healthy gut, how one can have, a healthy oral cavity. So today's topic is going to be very, very interesting for everyone. And I think everyone who uses toothpaste in the morning must know that what is actually going inside the toothpaste, and
Yeah.
all sort of ads and crores of rupees are spent on the advertisements. But let's today talk about how the whole thing is playing out and what is the role of oral microbiome. So over to you, Sushant. Let's
Thank
talk
you,
about
sir.
a very interesting topic.
Thank you, sir. So we have been, working. Maybe I was researching a lot on the oral microbiome for almost last 1 year, right? Because there have been a lot of things going around oral microbiome, and what a lot of people uh, do not understand that there are around 45% overlap in the oral and the gut microbiome, right? And we discussed in our previous presentation also that a lot of these some bacteria. So 140 billion bacterial cells we every time through our saliva when we swallow our saliva, 1 liter saliva, it goes to our gut, right? So essentially, again, for everyone, not trying to digress from the topic, but uh, you know uh, same bacteria can do different things in the mouth and in gut, right? So essentially, the existence of organisms doesn't say anything. So most of the companies in India, except us, who are actually focusing on the existence of bacteria, are not going to solve anything, right? So do not fall for such. You have to focus on the functions that they are doing, right?
Correct.
So that's what thing is, and we'll discuss certain pathways today in oral microbiome also, right? That how we decode everything, how we'll be telling you about your bad breath, about your your dental health, your oral inflammation, right? The LPS is also produced by the oral microbiome, right? So essentially today we'll start basically with with the focus on the oral hygiene, right? So there are two things we have to focus from oral microbiome perspective. One is obviously the food we eat, right? The nutrition choices. Again, uh, we'll talk not about food. We'll talk about the molecular ingredients in the food, right? But the most important part is the oral hygiene, or the brushing techniques, the flossing techniques, the scraping techniques, right? What kind of toothpaste, what kind of mouthwash we use, right? So essentially, most of the dentists uh, in India elsewhere focus on the teeth care, right? So essentially, if you have cavities, you'll have root canal, or there'll be some cleaning of biofilm formation, right? But the focus on the oral hygiene is still missing, right? And
Right.
the oral microbiome is as important as the gut microbiome because it is the starting point of digestive tube. So digestion starts at the mouth, not at the small intestine or the stomach, right? Uh, so again, we know we have to brush twice a day. We have to use toothpaste, right? Uh, I'm not sure, but a lot of what is my view of, I'm not a brand cautious when it comes to toothpaste, right? So I may look at price, or I may look at, whatever is available, or maybe sometimes there are a lot of advertisement of certain brands like Vico, which claims that they don't have a lot of bad things. So essentially, it's more of herbal, people say herbal, or, Ayurvedic and a lot of these toothpaste, right? So essentially, I don't know. I don't have a brand preference for toothpaste, right? So essentially, we buy, we think everything toothpaste is good and we buy that, right? But first thing is we have to understand we have to brush twice a day, right? And there are, and why do we brush, right? So essentially, there is a plaque buildup which happens because of the food we eat, because of the environment we are exposed to, toxin, pollution, a lot of these things, right? So plaque can cause cavities, it can erode gum, it can, lead to swelling, bleeding, it can also lead to leaky mouth. Gingivitis, again, which is caused by P. gingivalis and Streptococcus mutans, which are two of the most prevalent pathogens inside our mouth, right? So
True. Yeah.
again, one more thing is that these brushing techniques also bring the immune cells and the nutrition together. So it strengthens your mucosal barrier, your protective barrier, right?
Right.
So that is one thing very, very important. The other thing is, I'm not sure. So do you use both hands while brushing your teeth?
No, generally the right hand only.
Yeah. So that is one thing. So first thing is minimum 2 minutes you have to brush. It
Hmm.
should be on every quadrant of your mouth, of your teeth. It should be on every surface, inner, outer teeth, around the gums, everywhere. You know, uh, Using both hands can actually make sure that you are
I will
making
try
sure
that.
brush,
That
yeah.
now. Yeah.
Or possibly if you have probably you can use electric brushes also. You can set up timers or electric brushes, right?
Hmm.
So that is, it should go to any nook and corner, right? That's really, really important, right?
Yeah.
To avoid plaque buildup, right? And if uh, we consume a lot of acidic foods or sugar, right?
Hmm.
So what I mean by acidic foods is a lot of these bacteria in the mouth, they actually, metabolize all these acidic foods and sugar. They convert into acetic, lactic acid and succinic acid, which changes your saliva pH level, make it more acidic, and which is a breeding ground for a lot of pathogens. Even in fact, this acid can get into your teeth, your dentin, and can lead to tooth decay and a lot of these things, right? So essentially, if you are consuming a lot of sugary foods, probably if you are consuming in the evening, right, or at night, probably uh, avoid brushing for at least 30 minutes, because these foods already disrupt your gum, already disrupt your teeth, and immediately brushing will further disrupt your enamel, right? Impact your enamel, right? So these are few things you should follow.
That's a very important point because I was always thinking that I had some acidic food, so I should immediately brush. So very
Mhm.
good point which you have raised is rather not brush it for at least 30 minutes.
Yeah.
Yeah, excellent point. Very important for the enamel part of it. Yeah.
Second is again flossing, right? We Flossing should be done once a day, right? Because it removes dental plaque.
Hmm.
It helps you, keep you away from the periodontitis or periodontal disease. Probably, keeps gingivitis and streptococcus away, right?
Hmm.
Flossing at night can also reduce the risk of cardiovascular disease. So, from a cardiovascular disease, what I would like to share that, a lot of these bacteria produce TMA, as we mentioned about in the gut also, that,
Hmm.
the TMA is a byproduct of choline, right? Similarly, a lot of bacteria in the mouth produce TMA, which gets converted to TMAO, which is a reason of arthritis lesions inside our body, right? So essentially, flossing at night can actually keep our oral microbiome in check, and it reduces the risk of cardiovascular diseases, right?
Important point.
Again, yeah. So this is really, really important, because people should understand that the bacteria in mouth can cause diabetes, can cause obesity, can cause cardiovascular disease, can impact and even lead to dementia. Certain compounds like LPS and amyloids can actually cross the blood-brain barrier. When you have a leaky mouth, it can trigger inflammation, neuroinflammation, and so that is really, really important to understand, right?
Correct.
Uh, again, electric flosser is something I would recommend, because it helps for better plaque removal. But do not floss too much, because it can lead to gum bleeding, which can again further trigger inflammation, right? So
Hmm.
so you be very gentle and kind while you're flossing, right? Right? And then comes the tongue scraper. It is like brushing your teeth. You have to do at least twice a day. So
Hmm.
what happens is that a lot of food we eat, for instance, you're consuming a lot of eggs and
Hmm.
cruciferous vegetables which are high in sulfides or polyamines, like soy, like citrus fruits, like cheese, right?
Correct.
Shellfish, right?
Hmm.
So the leftover particles and the
Hmm.
leftover bacteria in the mouth, that can be converted by oral microbiome into polyamines and sulfides, right, which can trigger bad breath and which can lead to dry mouth, right?
Yeah.
So scrapping helps remove these unwanted thing inside the mouth, right? So
Hmm.
it keeps your fresh breath, it keeps you away from dry mouth, it keeps you away from excessive inflammation, right?
Correct.
So this is really, really important from a flossing and scrapping perspective, right? So these should be a part of our hygiene practices, right? Right. So again, when we talk of acidic foods, right?
Hmm.
Uh, acidic foods like sugar, what we mentioned, lemon, packaged fruit juices which are high in sugar, right? Or maybe donuts and a lot of these high sugary foods, which converts into, which is converted by microbiome into lactic acid, succinic acid, right? Which can erode teeth. It can lead to biofilm. So biofilm is basically like caves inside your mouth, right? So a lot of
Hmm.
these, so what happens is, when we form biofilms, a lot of these bacteria come together, they share their DNA, they help each other to survive, right?
Yeah.
So these like a bacterial party, right? So a lot of these can bacteria can trigger inflammation, can lead to periodontal gingivitis, or maybe even leaky mouth, right? So which can trigger systemic inflammation everywhere.
Correct.
So that is an important. Again, acidic foods will pull the calcium and phosphorus from the teeth, leading to tooth decay.
Yeah.
So this is a basic chart which I have put, which clearly shows the food acidic level. Probably everyone can find this on Google. You can easily find there. We should not have foods which have a saliva pH level below 6.2, right?
Hmm.
Right, which are really acidic, which changes your acid pH level of your mouth, and which is starting point of a lot of
And what you're saying
diseases.
is colas are off the chart, means they are very acidic, or how do you
Colas तो लेना ही नहीं चाहिए, these,
anything? Yeah.
because these have added sugar. And again, I'll mention here that if so, there are only four things where you have, natural sugar: milk, grains, fruits, and vegetables,
Hmm.
right? Rest all, even honey,
Hmm.
right,
Hmm.
is not a natural sugar. It is again added. If you're buying a peanut butter and saying there's a naturally occurring sugar, please check what is the naturally occurring sugar. There's nothing called naturally occurring sugar if it
Hmm.
doesn't have grains and vegetables or fruits, right?
Correct. Correct. Correct.
So anything anything else is just added sugar, right?
Right.
Which
Yeah.
which will,
Which will.
I've seen a lot of, I was listening to one of the talks a few months back, which was saying that, थोड़ा सा sugar लेने से कुछ नहीं होता है, 1 gram, 2 gram, 3 gram, but you don't understand, it is, we generally, resonate sugar with weight gain and
Hmm.
obesity, right? Or type 2 diabetes, right? But
Yeah.
sugar can do bad things inside our mouth, which can lead to very systemic inflammation, right?
Yeah.
And
Yeah.
and even
That's
dementia,
another
right?
that's another very good takeaway point for everyone. Sugar is not only diabetes issue.
Mm.
It's also about a lot of other things in the health, including oral health. Very good.
Mm.
Yeah.
Yeah. So let us talk about, important, one of the most important aspects is toothpaste and mouthwashes. First of all, consider mouthwash, antibacterial mouthwash similar to your antibiotics.
Hmm.
What antibiotics does to your gut, antibacterial mouthwash does the same to your mouth, right? So it washes away a lot of oral microbes, including good and bad both. So you have a very low microbial composition diversity, right? So it
Right.
can lead to suboptimal microbial functions, which can trigger inflammation, which can lead to a lot of gum disease and gingivitis and dry
Correct.
mouth, a lot of these things, right? So
Correct.
again, when we talk of toothpaste, just
Hmm.
हमारे पास जब दांत में सेंसिटिविटी होती है, कुछ होता है, राइट? सो हम लोग जनरली क्या कहते हैं कि Sensodyne toothpaste, lot of these things are come, right? So but if you see the label of these foods, you will have a lot of these things called, let us start with that, sodium lauryl sulfate, SLS,
Yeah,
right?
that's detergent, very harsh detergent. We
Yeah,
use it in the lab. Uh,
yeah.
yeah.
So if you have that, if you feel that coolness when you brush and you drink water, or you have a lot of foamy thing, there is nothing but SLS for you, right? So this is really bad. This should not be part of your toothpaste, right? It has
Yeah.
a lot of allergic and toxin reactions, right? It is a potential endocrine disruptor. It can disrupt your hormonal imbalances,
Yeah.
right? It has a potential to cause ulcers in mouth,
Yeah.
right? Right. Then a byproduct of SLS, which is 1,4 dioxane, right?
Right. Yeah.
is a potential carcinogen.
Mm.
There's a high risk of cancerous situations when you consume, right? So consider this as bad as alcohol and smoking when it comes to oral and throat cancer. Right? So yeah, so
And
this is yeah.
a lot of people may not be knowing, but sodium lauryl sulfate and sodium dodecyl sulfate, both of them are actually protein denaturants as well. So as you correctly said that it actually kills a lot of good bacteria. It denatures a lot of proteins, and so one needs to be very careful with this. And a lot of people have mouth ulcers or redness when it is because of this, SLS,
Yeah.
maybe higher concentration or maybe not a good quality.
Yeah.
Yeah.
So this is something you should look. First thing is SLS. You should look in your toothpaste and your mouthwashes, right?
Mm,
That should not be part of it.
correct.
Right. Second is triclosan. Triclosan again is another additive in the toothpaste, right? So triclosan when combines with chlorine in water can cause chloroform, which is classified as possible hormonal carcinogen, right?
Correct.
It disrupts your thyroid function. So people who are thinking, I have hypothyroidism, let me, eat less carbs and let me reduce my weight, right? You may not know that your toothpaste is making you develop hypothyroidism, right?
Well,
So,
that's a good regulation. I mean, yeah. Okay.
yeah. Then comes to saccharin. Saccharin, we know there have been saccharin aspartame has been in use for all the bad reasons, right? WHO has marked this as a possible cancer-causing ingredient, right?
Yeah.
Right. So saccharin has been linked to obesity, type 2 diabetes, and cancer situation, right? Aspartame is really, really acidic. It causes glucose intolerance. So,
Mm,
sir, I was seeing a lot of post around it that people are saying, कुछ नहीं तो थोड़ा बहुत artificial sweetener ले लो, चलता है aspartame. हम लोग it's found in 6,000 plus foods, right? So,
yeah.
so the food industry is really, 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 now uh, worried, and they are actually trying to find out a way that let's promote these artificial sweeteners as a substitute for sugar, right? But the thing
Mm,
is very basic fundamental. Let's not get into some research. People may or may not agree with us. That is their cause, right? Their decision. But the basic fundamental is when you consume anything, right? You
mm,
first encounter the microbes in your mouth, right?
mm, yeah.
Which pre-digest these things and convert into certain chemicals and byproducts. When they do that, they send a signal to your gut microbiome, to your other body organs like pancreas, right?
Mm,
So via gut microbiome, pancreas start releasing insulin because for these folks in the mouth, they think something sweet, so we have to release pancreas, right? We have to
mm,
release insulin, right? So pancreas start releasing insulin, and when this compound moves down, so there's no glucose to be metabolized because it's generally no calories, right? So that's why the insulin keeps on floating in the blood, right? And over a period of time, this leads to insulin resistance, right?
yes, yeah.
So that starting point of your diabetes, obesity,
Mm,
even mental health issues, right?
mm,
Glucose intolerance. So basic fundamental, right? This is the basic thing, And it also, if you go a bit more into science, it actually feeds a lot of bad bacteria, which can become pathogens, which can cause food poisoning, blood poisoning, sepsis. It can cause. So this is something we discussed. I think we did a video on
on this, yeah, already.
yeah, yeah,
All in one, yeah.
yeah. So again, paraben, these all are found in most of the toothpaste, right? So you check the labels, right? Paraben
Mm,
again reduces the oral microbiome count and diversity. It increases the risk of eczema and asthma in children, right?
mm,
So again, if you are buying some toothpaste for your children, probably please do look at if the toothpaste have, or the mouthwash has paraben or not, right?
mm,
Uh,
mm,
that is something really important, right? So
yeah.
propylene glycol again a bad thing, right?
Yeah.
What it does is it absorbs the moisture from the environment. So what we know is we discussed in our previous talks that the saliva in our mouth, right?
Mm,
It's really, really important because it maintains that balance and give the nutrients to your bacteria. It starves bad bacteria of nutrients. It develops immunoglobulins, a lot of these things, right, which strengthens the mucosal barrier, right? But this particular compound, propylene glycol, this absorbs the moisture from the environment, lowers saliva. When you have a dry mouth, right? Bad breath, cavities, right? It creates an environment for the bad people, bad bugs to grow, right? So again, this all are a part of your toothpaste, which we generally include, and which we don't know they are bad. Similarly, sucralose, artificial sweeteners, right? We know it disrupts the gut bacteria, it causes IBD, leaky gut, diabetes, obesity, right? So
Absolutely.
these are some of and these are found in toothpaste and mouthwashes both, right?
True.
Right. So these are few things which we should consider, right? It is not something we should do away with, or we should avoid, right? Please look at your toothpaste labels, mouthwash
Right.
labels. Right?
Absolutely.
So these are some of the pathways we consider right here. So again, when we talk of bad breath, right, as we discussed, right. So a lot of foods like sulfides, like green leafy cruciferous vegetables or eggs, which are high in sulfur, right. A lot of these bacteria convert this into sulfide like H2SN and methylcryptan, right, and they can lead to bad breath, or polyamines, right, like shellfish, soy, a lot of pulses, right? If we have a lot of bacteria which are capable of producing polyamines like putstine, spodumine, cadrine, right? A lot of these, which
Lovely.
leads to bad breath, which leads to dry mouth, which can trigger cavities, right? So we look at breath odor assessment, right? Which is so if you are using these toothpaste which is full of these ingredients, there's a chances that you will have a bad breath, right? And
Correct.
and these toothpaste along with such foods which you are consuming, probably if you have those bugs active and overgrown in your mouth, right, that can lead to bad breath, right?
Bad. Yeah, absolutely.
So again, gum inflammation. So gum inflammation, a lot of these things. So we have an immune system inside our mouth, right? So essentially, the interaction between microbiome and immune system can trigger inflammatory reactions, which can harm your gums, right? So one of this is a lot of pro-inflammatory pathways we see at LPS, we see at TMAO, right? Amyloid, a lot of these pathways, right? You also
Right.
look at, a lot of these microbes, they eat up your mucin, and mucin is something which is required, which is active as a barrier inside your mouth, right? So mucin can be converted to fucose and silica acid. Sorry, it's a spell mistake, sialic acid, right? So which again can trigger inflammation, can impact and lead to gum disease, right?
Absolutely.
Right. And then dental health, we see the enamel health. We look at a lot of these LPS pathways, right? And a lot of these inflammatory actions having inside the mouth that impacts your, and especially the sugar things, right? The sugary foods if we eat, right? Oral cavities, again, oral cavities caused by your sugary food, which is gets converted to succinic acid and lactic acid, right? And it also leads to biofilm formation. So one of the things we should consider is, again, I'm not blaming these companies, but a lot of these people who are selling kombucha or kombucha drinks, or people who are even making a lot of these, because actually should be fermented with yeast, right? If you are if you need the right kombucha, which is a healthy version, which is a probiotic, which helps your rebalance or improve the diversity of your gut microbiome, right? But essentially with sugar, so sugars, it's actually fermentation, it burns into your acid, and even if you consume it, gets converted into acid inside your mouth, which can disrupt your oral saliva pH level, which can lead to cavities and gingivitis and a lot of these issues, right? So essentially, look at if you're buying kombucha, look at your the label of kombucha, how much cane sugar or sugar it has, right? Because that is really, really important, right? Then nitric oxide, right? We know nitric oxide is really, really essential for regulating our blood pressure, improving our insulin sensitivity, right? Improving our heart function. Again, a lot of these beet greens foods which are converted from nitrate into nitric oxide by oral microbiome, good bacteria, good bugs, right? So essentially, we really need to have a improved production of nitric oxide. So bacteria in your mouth can cause you hypertension or heart disease, right?
Yeah.
If you don't producing enough of nitric oxide, right?
Mhm.
Again, so we don't talk of foods, we talk of molecular ingredients. So food is actually a byproduct, right? So
Yeah.
essentially, nitrate, as I mentioned about nitric oxide, food high in greens, but it also has to go with other pathways, right? So if you're probably consuming broccoli, broccoli is high in sulfide production, so it can lead to bad breath. It may help you in nitrate production. So this has to be a balance, right? Again, this is where precision nutrition comes into picture, right?
Yep.
Right. So that is something really, really important. Second thing is nitrogen, right? So peanuts, L-arginine, right? One of the
Amino-
ammonia producing, right? So
Yeah.
so to some extent it really helps in regulating the saliva pH level if it's more acidic, right? If you're consuming a lot of sugar, so probably these can help rather than going for medicines. Probably these are certain hacks which can
Yeah.
help you regulate your pH level, right?
Yeah.
Terpenes, we know. Again, we think mango, I think mango will cause diabetes or, obesity. It's very, very sweet, but, mango is high in terpenes, right? Which
Mm.
really helps you, really great for your dental health, for your gum health, right?
Mm.
Polyphenols, berries, green tea, herbs, spices. There are a lot of herbs like sage, rosemary, right? Really, really help your gum and dental health, right? Beta carotene, nectarines, peaches, right? Watermelons. These are the foods which can regulate your oral health. Lycopene, we know, lycopene is one of the essential antioxidants we find in tomato, right? So these are really, really important, right? Again, antioxidants, blueberries, blackberries, right? These are
Yeah.
the foods which can, help you support your gum health, your situations of oral cavities. Anthocyanins, berries, currants, right? Upper leg, red potato, elderberry. So I'm just giving some examples. I don't know whether these foods, it's a generic examples. I'm
Mm.
not sure whether these foods will work for someone or not, right? It all depends upon the how your functions of microbiome or functions of the gut microbiome or
Correct.
microbiome. So these are few things. These are some of the pathways are included. We are actually decoding 10 pathways, right? So a lot of people who would sign up for our oral microbiome test, which we are launching soon in end of August, first week of September, right? So essentially, you will get nutrition intervention. You get this 10 pathways. You can get nutrition intervention. You get oral hygiene recommendations, right? And if you want,
Yeah.
we can make a detailed report for the doctor, for the dentist as well.
That would be really, really helpful,
Yeah, yeah. So these are the few things which we should consider when we talk of the oral microbiome, right? Uh, Certain oral hygiene thing which should be taken care of, right? Uh, that is something we wanted to discuss today, and I think we should also discuss a bit about DNA, right? I
Mm.
was thinking probably take this opportunity to also shed some light on DNA, right?
Yeah.
So probably let's discuss something on the DNA front also, the DNA testing, the human DNA testing, the microbial DNA testing.
Sure. Sure. So you want to cover in this particular talk, or maybe?
Yeah, we can talk for 10, 12 minutes. Probably that will given because again a lot of these dental genetic things are also coming up. So probably we can have an overall broad view of DNA testing, why DNA testing, why not DNA testing.
Yeah. So what are your views? I would be very keen, yeah, what's going on in your mind, because you have been noticing this space quite a bit, and
Hmm.
people have been talking very extensively about DNA. But what are your views? And then I think I can also, put my points
Okay.
across.
Okay, I'll start. So what I think is, 1990 Human Genome Project was started. It culminated into 1 3, right? And if
Right.
you see from since then, the incidence of chronic disease and cancer is growing, right? Especially in the last 5 years, right?
Correct.
So DNA, you know, is something which we are born with the DNA, right? Whether it is human DNA or the microbial DNA, the microbes. So again, human DNA is just 1% total genetic profile, 99% is microbial, right? And again, DNA just tells you potential. So if I have an FTO gene, right, uh,
Mhm.
I may or may not develop obesity, right? But it only tells a potential, right? So if you see if someone is having diabetes, uh, multiple sclerosis, cardiovascular diseases, right? If you compare their DNA with the DNA of a healthy person like you and me, right? Their DNA would be same.
Same, absolutely. Genes, rather it will be the expression of those genes, which is
Yeah,
important. It should be
yeah,
highlighted. It should be either at RNA level or protein levels or transcription level or
yeah,
translation
yeah.
level. Absolutely.
So another thing is that, if we see mouth, liver, heart, right? Everyone has the same identical DNA,
Hmm.
but all these perform different functions,
Hmm.
right?
Hmm. Yeah.
So essentially, it is the expression of those genes inside the DNA which is actually making us do different functions, right?
Right.
Similarly, DNA testing would not help. Okay, it may help for rare genetic disorder, which is 5%, 7% of the total disease profile in India and elsewhere. But if you talk of chronic diseases, it has nothing to do with DNA, right?
Yeah. Yeah.
So that is something which we should not fall for, because a lot of companies are focusing on DNA testing, and there was certain research which came on
Yeah.
twins.
Yeah.
1002 twins. There was a research which came that twins reacted to food in different way,
Ah.
right?
Oh.
So
And
twins,
they have same genes, at least the
same genes.
identical twins, they
Yeah,
have
yeah,
same genes, same set
yeah,
of genes.
yeah. So their glycemic response, it was actually on glycemic response. Their glycemic response to same food was entirely different.
Yeah.
Yeah. So
So
that is, yeah, yes, sir.
yeah, so what I would say is, as a a guy who has done, I mean, I have done a lot of research work on genetics and genomics and stuff. So as
Mhm.
far as uh, susceptibility is concerned or mutations are concerned, that's where you can actually do analysis at the gene level and see whether that guy will be susceptible or he will have a hereditary disease or blah blah. But when it comes to the activity piece, what we are talking about, when we are talking about microbiome space, when we are talking about how humans are expressing, how genes are getting expressed with relation to these microbiomes or even other external factors. So
Mhm.
you are correct. That's where the DNA analysis will not help. DNA
Mhm.
analysis can tell, that somebody is having a genetic disorder, versus he may not have genetic disorder, if his gene is correct. But
Mhm.
how the whole metabolic pathways will work, how the interaction with the environment will happen, how microbiome interaction will happen, how microbiome will impact is
Mhm.
all about how the genes
Gene.
are getting expressed, how they are
Right.
getting expressed in the uh, vicinity of the environment, in which the host human is present. So,
Mhm.
excellent point. I think a lot of people should understand, at least the common man.
Yeah,
Other
yeah, because
level of
we
DNA
should
is
not
important.
blame genes. We should not
Yeah,
blame our genes for it, So
right, right.
it's really important. So it's really funny, we can't say, if I have developed cancer, it is because of genes. And unfortunately, a lot of doctors are promoting it. I've seen a lot of doctors saying it. So there's a lot of guesswork going on, right?
Yeah.
So essentially, this is something which
That's
we
where I
should focus.
use the word genetic susceptibility. So you may
Yeah,
be susceptible, which does not
yeah,
mean that you will guaranteed, develop that.
yeah,
It's
yeah.
actually a function of the environment and microbiome and everything
Mhm.
else. Your habits, your environment which you are creating around you, uh,
Mm.
chemical milieu around your cells. Uh, so
Mhm.
that's the point.
Sure, sure. So that is what I wanted to discuss, right?
I think
So
this, yeah,
yes, sir.
please go ahead.
No, I was thinking probably, we should also, we did this webinar on a lot of things, but it was briefly covered with a lot of things. So I was thinking, we should also discuss about the next thing what we are bringing is the prediction model, right, for diabetes
Hmm.
also. So let us mark a date for, let's discuss that also maybe next week.
Absolutely, absolutely. Let's do it. And this is exceptionally good work, which can help millions and millions of people. So my wish should be, my wish would be it should reach out to maximum number of people. We talk science here. We are not particularly promoting any specific product or anything. We want that people should get rid of chronic diseases, and wherever Gene Fretletics can help, wherever you and me can help, we are ready to do that. So we are very excited to do that, rather.
Yeah, yeah. And so let's continue the conversations. Yeah.
Absolutely. Looking forward, and let's plan for the next one shortly. So thank you everyone for your valuable time. Stay tuned to the channel, and I'm sure you will benefit a lot. Thank you so
Yeah.
much.
Thank you.
Bye.
Thank you, sir. Bye-bye.
Bye.
Bye.